Hey, welcome to The Explainer. Today we're going to break down a pretty amazing technique for clearing your lungs. And honestly, it's all laid out on this one simple cheat sheet. Now, if you've ever dealt with something like pneumonia or cystic fibrosis, you know how serious mucus buildup can be. But what's so cool about this method is that it doesn't use fancy drugs. It uses one of the most basic forces in the entire universe.
So, let's start with this question because it really gets to the heart of the whole thing. What if the secret wasn't some complicated machine, but just, knowing how to position your own body? What if it was really that simple? Well, that basic force we were talking about? Yep, it's gravity. The technique is called postural drainage, and the idea is just so beautifully simple. You basically position the body so that the part of the lung you need to clear is aimed down, and then you just let gravity do all the heavy lifting for you, moving that mucus out so it can be cleared.
Okay, let's dive right in. Think of this as a quick tour of the lungs, and we're going to start at the very top, the upper lobes. As you'll see, these are usually the easiest ones to get to.
So this first position, it just makes sense, right? To drain the front part of the upper lobes, that's the anterior section, you just lie flat on your back. That's it. This angle lets any gunk in there flow down toward the main airways.
Now look at this little switch up. To hit the very, very top, the back sections of the lungs, what they call the apical segments, the patient just sits up and leans forward. It's such a simple change in posture, but it specifically targets those really hard to reach peaks. Pretty clever.
All right, let's move down a bit to the middle of the chest. This is where things get really interesting, because we're going to introduce a new little twist that completely changes the game: elevation.
And for this next part, this number is absolutely crucial: 12 inches. By raising the feet just this amount, we create the perfect downward slope to target the middle sections of the lungs.
And this slide right here shows you one of the core principles of this whole thing. Get this, to drain one side, you actually lie on the opposite side. So for the right middle lobe, you're on your left side with your feet up. And for the left side's version, the lingula, you just flip and lie on your right. It's a perfect mirror image.
Okay, now for what can be the trickiest area. We're going down to the very bottom of the lungs, the bases. This is where fluid really loves to settle, so it needs a bit more encouragement to get moving. And to get that job done, we need to crank up the angle. So the elevation goes up pretty significantly to 18 inches. This creates a much stronger pull from gravity, which is exactly what we need for these deep parts of the lungs.
And you'll see the same principles we've already learned are at play here. To drain the front or anterior lower lobes, you're on your back, but this time with that much steeper 18-inch elevation.
And following that same logic, what do you do to get to the back or posterior lower lobes? You got it. You just flip over. You lie on your stomach, again with your feet hiked up 18 inches. The logic is so consistent. Front is on your back is on your stomach. And what about the sides of the lower lobes, the lateral segments? Well, by now you've probably guessed it. You lie on the opposite side, keeping that 18-inch elevation. See, the pattern just holds true all the way down. Now, there is one tiny exception to the whole elevation rule when we're talking about the lower lobes. The superior segments, which are kind of the top part of the lower lobes, they're best drained by lying flat on your stomach, but with a pillow just under your hips to give it a little tilt. So no steep elevation needed for this one spot.
Okay, I know, that was a lot of different positions. But what if I told you that you don't actually have to memorize a dozen different things? Let's boil this all down into a super simple, powerful way to think about it.
This is where it all clicks. Seriously, instead of memorizing all those positions, you just need to remember 4 core ideas. Want to drain the front? Lie on your back. The back? Lie on your stomach. The sides? Lie on the opposite side. The only other thing you need to know is the elevation. 12 inches for the middle, 18 for the lower bases. That's the entire system, right there in a nutshell.
So, you see, at the end of the day, this isn't about some complicated procedure or expensive equipment. It's just a really smart, kind of elegant way to use basic physics. You use the body's position to create the path, and a fundamental force of nature does all the work for you.
And that kind of leaves us with a final question to think about. In this age of super high-tech medicine, are we maybe overlooking the simple, profound power of things like this? How many other health problems could be helped just by